Which of the following statement relating to the alveolar ventilation is untrue? That means which of the following structure is not true regarding the alveolar ventilation. So what is the false statement regarding the alveolar ventilation? Here are the options. Anatomical dead space is measured by helium dilution. Physiological dead space is increase in pulmonary embolism. Alveolar ventilation is defined as volume of the air entering the alveolar per minute. Anatomical dead space is measured by adrenaline. Type 2 pneumocyte in the alveoli, its secret surfactant. So first of all, let's see the alveolar ventilation or minute ventilation. It is the total amount of the gas ventilated per minute. So it is the tidal volume into the respiratory rate. Now the dead space ventilation, it describes the volume of the gas not involved in exchange the blood. There are two types of the dead space. One is the anatomical, another one is the physiological. Normally, physiologically, anatomical dead space is 150 mL. And the volume of the gas in the respiratory tree not involved in the gaseous exchange, they are known as the anatomical dead space. And here the site of the anatomical dead space: mouth, pharynx, trachea, bronchi and terminal bronchiole. So from the mouth to the terminal bronchiole, they are the location of the anatomical dead space. Now the measured by the Fowler's method. So the dead space, it is measured by the Fowler's method, and it is increased by standing, because when they are standing, lung volume increases and alveolar volume also increases. Increased size of the person, big lung, big alveoli, increase lung volume. So when lung volume increase, alveolar volume also increase. Drug causing bronchodilation, such as the adrenaline. So when there is the bronchodilation occur, then more air entry in the lungs. Then the physiological dead space, it is normally 150 ml. So physiological dead space, it is also 150 ml. And the alveolar ventilation of the volume of the fresh air enters the alveolar per minute. So per minute, how ml of air entry, it is known as the alveolar ventilation. So alveolar ventilation equal to minute ventilation by dead space volume. And this is the helium dilution method, and with the helium dilution method we can measure the functional residual capacity. But alveolar ventilation, it is measured by the Fowler method. So here it is ready that anatomical dead space, it is measured by helium dilution test. It is not true, because by helium dilution test we measure the functional residual capacity, and anatomical dead space it is measured by Fowler method. Physiological dead space is increased by pulmonary embolism. It is also true, because in case of pulmonary embolism, there is the less gas exchange area in the lungs. Alveolar ventilation is defined as volume of fresh air entering the alveolar per minute. It is the measured within the minute. Anatomical dead space is increased by adrenaline. It is also true, because the adrenaline, what it does, it causes increased diameter of the bronchi, and so the anatomical dead space increases. Type 2 pneumocyte in the alveoli, they secrete surfactant. It is also true, because the type 1 surfactant, type 1 pneumocyte responsible for gas exchange, type 2 responsible for surfactant secretion, and alveolar macrophage, they are responsible for the defense.